What is stages of grief, anger? The stages of grief are a model for understanding the emotional process that people experience after a significant loss or change. The model was first introduced by psychiatrist Elizabeth Kubler-Ross in her book On Death and Dying in 1969. The 5 stages of grief include denial, anger, bargaining, depression, and acceptance. In this essay, we will focus on the second stage of grief, anger. Anger is a normal and natural reaction to loss. When people experience loss, they often feel a sense of injustice, and anger is a way of expressing this injustice. Anger can be directed at a variety of targets, including oneself, others, and even the person or thing that is responsible for the loss. The experience of anger during the grieving process can take many forms. Some people become irritable and short-tempered, while others become more aggressive and confrontational. Some people may try to suppress their anger, while others may express it openly and directly. Regardless of how it is expressed, anger is a common and expected part of the grieving process. One reason that anger is a natural response to loss is that it can be a coping mechanism. Anger can provide a sense of control and empowerment during a time when people may feel powerless and vulnerable. Anger can also be a way of expressing the pain and hurt that people are feeling, and can be a way of seeking support and validation from others. However, it is important to note that anger can also be a destructive force during the grieving process. If anger is not expressed in a healthy and constructive way, it can damage relationships and prolong the grieving process. It can also lead to feelings of guilt and shame, which can further complicate the healing process. There are several strategies that people can use to manage their anger during the grieving process. The first step is to recognize and acknowledge the anger. This can be done by expressing the anger in a safe and healthy way, such as through journaling, talking to a trusted friend or family member, or engaging in physical activity. It is important to avoid lashing out at others or engaging in destructive behavior. Another strategy for managing anger during the grieving process is to practice self-care. This can include getting enough sleep, eating a healthy diet, and engaging in activities that bring joy and relaxation. Engaging in self-care can help to reduce stress and anxiety, which can contribute to feelings of anger. Finally, seeking support from others can be an important strategy for managing anger during the grieving process. This can include seeking professional counseling or therapy, joining a support group, or reaching out to friends and family members for support. Talking about the loss and the emotions associated with it can be a powerful way to process the grief and move towards healing. In conclusion, anger is a normal and natural part of the grieving process. It can be a coping mechanism and a way of expressing the pain and hurt associated with loss. However, if not managed in a healthy and constructive way, anger can be a destructive force that prolongs the grieving process and damages relationships. By recognizing and acknowledging the anger, practicing self-care, and seeking support from others, people can manage their anger and move towards healing after a significant loss or change.